Well, hold
Sorry,
on.
I'm kind of
You
drunk.
just said a
I'm not
second
gonna
ago
lie.
that you think it's wrong that they are going off of what the person is telling them, and I'm saying that's
Well,
the
no, no,
only
no.
way that
I think
psychiatrists
that
can
gender
work.
dysphoria is not enough. I think you need extreme, persistent, treatment-resistant gender dysphoria, and
That's what
like,
gender
I
dysphoria
don't think
is.
they. Oh, I was about to say.
Hold
You
on, hold
said
on,
they need to
hold on,
figure out.
wait.
Oh, sorry.
Hold on. I'm sorry. Hold on. When you are saying that, you are talking about gender dysphoria. Gender dysphoria already is a strong persistence within this area to make it a mental illness. Allie,
Hello.
how's it going?
I am doing okay. I like was snowed in today, which was kind of nice because I expected it, but my Wi-Fi went out, so that was like not as nice.
Where do
So
you
I'm on a
live?
hotspot actually, but I've been on that all day. So
Where do you live?
I am in the South.
What?
Yes.
It's 50 degrees here right now. I'm in Atlanta. Where are you?
Well, okay,
What
so
the
the
hell?
snow is melting, but we just got snow. I mean, I don't know if I'm in Arkansas. I'll say that. I'm in Arkansas. The snow is melting and we're not like snowed in, but like classes were canceled and shit and like I didn't drive because I didn't need to because I got stuff. Like I went to the store and got stuff and also I'm a bad driver because stereotypes, but I actually am a bad driver and so if I can avoid driving on like the soaking wet roads, then I will. But yeah, we did get snow.
The last time you were on here, you were cracking a case on transgenderism.
Okay, wait.
How
I
did
was
that go?
cracking a case on biomedical interventions for pediatric gender dysphoria. Okay.
Yes, but also not just that, but how it was kind of like unethically being forced on younger children and how it was like being
Well,
how they were unethically like canceling people who had scientific backgrounds yet weren't going with the woke agenda and like all of this other
okay, wait.
stuff.
I don't think I would have used the words woke agenda.
You didn't, but that is what you were saying. You were
It is
saying
what I'm
that
saying. I honestly still kind of basically believe it because I was
okay.
like citing specific instances. Right. I think Kenneth Zucker actually was done dirty in Toronto or wherever his clinic got shuttered. I think people act really hysterical whenever Ray Blanchard does literally anything, even though he's a pretty well respected sexologist. Um, oh, what else?
Well,
There
so
is
the last time you were on here, we went over all of the information, and each thing that we went over, I would like go over it and be like, "Yeah, but the conclusion that you're drawing isn't there yet." And you're like, "It will be. I have it. I'll send it to you, and then this other thing, I just got to get this, and then I can send that to you." And then I just didn't get you didn't send me any of the stuff afterwards, so I just assumed you never found the information.
well, okay. So what happened was I did turn in a paper about that topic, and it was 25 pages, double spaced, and I mean, I think it was a good paper. I got a good grade on it, but like, I'm trying to basically because I do think that W path is fucking insane. Like when I talk about the like, it goes all the way to the top. Like when I start sounding crazy because I'm talking
Yeah.
about shit, like that's what I mean. I mean W path, the quote unquote World Professional Association for Transgender Health. It's just an American organization, basically. Like, yeah, they got some European doctors up in there, but it's like super headquartered in America and it was founded in America and it's always just been American. So like I'm basically asserting that like American activists are like pretty much going wild in this one area of psychiatry. And I mean in the UK where they're slowing down, they have cited the quote unquote gender affirmative approach as coming out of American gender clinics and they've distinguished that from like approaches of other parts of the world. So like we aren't just doing everything that the other people are doing. Like we took a way more liberal stance than the Netherlands people did or whatever whoever the fuck did Dutch protocol, Amsterdam, Utrecht clinic, that those people, they had a way more like rigid screening procedure for who got in. And so, but WPATH with this latest version, they just went like as hardcore as they could, right? So they've taken like a major shift since their seventh version, their eighth version of the standards of care came out this year. Or no, shit, it's 2023. Came out in 2022. The version before that came out in 2011. And 2011 was already like more liberal than what the Dutch did when they came out with their shit in like 2006 they started, and then 2011 more shit came out. But like we've gotten way more like left wing with the dealing out of these treatments at a rate that has like so far lapped the expansion in knowledge base about this and what it does is like basically my conclusion. And I think that's because of crazy activists in America.
I mean, I will agree that crazy activists in America are like causing more and more problems and like are like very confused on the science and stuff like that. But when last time we went over it, you were saying like, oh, they say that like this is what gender is and this is what sex is, and they're defining them wrong, and it's the it's the very like progressive version of it. And when I went and looked at it, it was something that I thought was like reasonable and made sense, and like the crazy far left trans activist people who are all nutcases. Like I disagree with them, and I don't think that their ideas will ever really get pushed into mainstream science just because it's like so far out there. Like they're so far outside of the bounds of reality.
Okay, it was forever ago, so I don't expect you to remember it, but is there any chance you remember which document you were talking about that was like in contention when you said you went back and read it? Like, is there any
Yes.
chance?
So it was okay. It was the American Psychiatric Association. Is that what it is?
Okay, so there's the American Psychiatric Association, that's who publishes the DSMs, and then there's the American Psychological Association, and that's who.
Psychological Association. So that's where we were having issues, is that I kept thinking you were saying psychiatric, but you were saying psychological. And when I went to the psychological website, their definition was they were referencing the psychiatric website, and the psychiatric website was something that we agreed on, but it was different from what you were saying it was. And so that's where we ended up having issues.
Yeah, it's so annoying because there are two mental health associations that are super different, but they're both the APA because they're the American Psychiatric Association and the American Psychological Association.
Yeah.
But
I mean, I'm surprised like that you're not more on board with this stuff. You look like you're transitioning pretty well. Your mustache is coming in really really heavily.
this is how I can get non-binary lived experience points for purposes of these conversations. I'm so gender non-conforming. Like
Oh, yeah, yeah.
women with masculine features, that's like so
Yeah,
powerful. I mean, like
true.
I'm not a woman though because neither woman nor man, right? That's what non-binary means. So like
It's
I
okay,
like
it's not that's not really what it means. Like I have a doc, and if you want to look at it sometime I can send it to you, but I have a document that where I explain what
explain
it is that
non-binary.
it includes non-binary. So non-binary is it's not absence of gender. It is an amalgamation of both uh, masculine and feminine features to where you would be hard to place on one side or the other of the spectrum. So they can't categorize you as one or the other because you're just kind of like in the middle somewhere. And so instead you're just non-binary. But that doesn't like disprove the binary or deny the existence of the binary. It just means that you are incapable of being categorized within the binary.
So is that like a sexually ambiguous person or an androgynous person in presentation? Like what do you mean when you say can't
It's
place them on one side or the other?
it's going to be a bit of both. So like your sex will normally drive your like gender expression a lot in the way that you're like your personality, the way that you dress, the way that you act, like body language, all of these different things. But it is but yeah, it is going to be more so like an androgynous person. Yeah.
Interesting. See, I just feel like that could be everybody. Like I was doing a little for one part, I thought I was going to talk about like the online subculture. I fell into non-binary rabbit hole, a non-binary rabbit hole. And it was like there was a little bit of a meme where it was like they would say shit that just straight up so many people would do and they'd be like, and that's how you know you're non-binary. And it's like, wait, what? Like they're like just like, "Oh, you don't like your body sometimes." Like, that's how I knew I was non-binary. Like, "Oh, like, sometimes you like to dress like how the opposite sex typically likes to dress." Like, that's how you know you're like I don't know, like,
But we call that cross-dressing though, right? Like, so normally we would say you personally have things within you that make you feminine, right? And that's normally because of your sex, right? Your sex is what makes you feminine. Your estrogen, your hormones, like your brain size, brain construction, brain waves, like all of this stuff is what makes you feminine. Now, but then there are mental disorders or mental illnesses that we call gender dysphoria, and that's where the brain patterns that we would expect from your sex do not align, and they're no longer aligning, and so we call that gender dysphoria, where now instead of you having the characteristics that we would expect from your sex, you have the opposite sex's characteristics.
okay, wait. You
You are
do
echoing a little bit while I'm talking as well.
okay. I wonder how I can fix that.
Just try to mute, I guess, when I talk. And
Yeah, I'll do that. Wait, let me
okay.
see if oh, okay. I wonder if I don't know how to get it to where you can just like press the space button when you want to talk. Do you know what I'm talking?
Oh, you you have to go into your settings, user settings, and
Oh,
then
wait, a push to talk.
yes. Yep. So I don't hear you right now if you're trying to talk. You have to be holding it down in order for me to hear you. All right. We got it
Oh,
working yet? Oh, yes. Let's go.
yay! I'm so sorry. I felt like such a like challenged old person during
It's
that whole
okay.
thing. I'm
Here,
so
real quick.
sorry.
So, where were we?
Um, okay, I will read your doc at some point. I'm back in school and I've got school stuff, but I will read the document. You were saying that you had a document that non-binary people were included. We had gotten to I can't remember if we ended on non-binary question mark or if we were doing the APA versus the APA document and contention fight. I can't remember the order of things.
Well, so in the doc, all I'm explaining is what we're communicating when we say words like man or woman, what types of ideas attach to that um, within the concept, and how these attach to reality. So I'm making very like descriptive claims of what these things are and what we are communicating, but not what I want it to be, not what it would be great if we did this or how we should progress to this point or anything like that. It's just very specifically like a pragmatic view of gender and then how this attaches to reality, or the world around us. And so I'm like being very descriptive, not prescriptive, but descriptive in the way that I say, this is what gender is. This is what we communicate. And the last time that I went over this on stream, when I got to the end of it, you said, but that's just personality. You're like that, so you're just saying gender is personality, when in reality personality is just one small piece of gender. It's like one more thing. Your personality can be feminine or masculine, but femininity and masculinity are what make your gender.
Yeah. I mean, I guess like I'm freaked out by the medical interventions. Like, where did the medical interventions come into it? Like, because we also talked about like, do you need gender dysphoria to get the operations and things? Like, where do you stand on that? If you don't mind me asking, because I don't because it's not that because I trust your calls on like how things are described. Like, you're the language person. Like, I don't know shit about that. I'm not gonna lie. Like, I trust your, but I'm like more worried about like what's going on in like psychiatry world. Like, psychiatrists are actually like not that much involved. They're just signing off on it because their book is the shit that gets people billable. So like health
So
insurance companies will pay for this stuff now.
mhm.
So it's like a whole new ball game. But sorry.
I mean, yeah, I think for the most part I'm gonna appeal to like doctors and people like that. So I think for the most part we have a good system. for these things where like they have to go through therapy. They have to like there's multiple levels of like getting to the point where there's a doctor that can give you some sort of prescription to HRT and puberty blockers and crap like that. But the and you can see when you get on like on Twitter or like you engage with like the far left. I'm sorry, hold on one second. Can you mute while I'm talking?
Yes.
Okay. So, so yeah, if you look at like a bunch of these far lefties and these trans activists online, you'll see they are like pushing these websites that will give children HRT and puberty blockers and all of this other crap, right? They so when you see that, I see that and I say, okay, the medical field obviously disagrees with these people on where the line should be. They feel like children, trans children, children with gender dysphoria are being cheated out of the medical like necessities that they deserve, and the medical fields disagree with them and are like, no, we're not giving them this medicine, that's ridiculous, this is too early, like blah blah blah. So it seems like there is a big separation between the far left and these trans activists and what they want and what like the medical fields are doing in reality.
Well, I will say, at least in America, there's like so much diversity, like depending on what part of the country you live in. Like in these other countries, like UK, Sweden, these places with more socialized healthcare systems, it's just super different by design. But here, I mean, there are like stretches of hundreds of miles where you actually have people who, like, if anybody's like solid candidates for these treatments, it's these people, and yet they have no realistic shot in hell, just getting like, just being honest, of like getting it done the formalized way. And then you have other places in America where it is like dead ass about as hard to get a gender dysphoria diagnosis as it is to like get a medical marijuana card. And it's like literally it just seems like luck of the draw, but the shit that is happening in these like boutique American gender clinics is seemingly kind of crazy.
Well, okay, so how do you think we're going to come to the conclusion that somebody has gender dysphoria? Like, how would we find that out?
Well, I don't think having gender dysphoria would be enough, right? Because I think that like gender dysphoria can happen for probably countless reasons. But you would want to show like that the person persists in gender dysphoria over time and that they're basically like resistant to other treatments, like treatments of underlying comorbidities, like namely.
What do you mean having gender dysphoria isn't enough? What does that mean?
Like, I mean, gender dysphoria is, I think, it's not like some immutable trait, right? It's just
It's a
like any
mental
other
illness.
DSM
Like,
diagnosis. Yeah, it's a
yeah.
mental illness. Yeah, so I think that you would, if you view it as a mental illness, you would view transition as like the most extreme treatment, right? Like
Yeah.
probably not everybody who's ever felt gender dysphoria needs to start body modifying, right? So there would be
Well,
some like
I would, yeah,
filtration
not body
process.
modifying, right? There's tons of people who transition without ever like getting any sort of surgery or anything. There's like that. It seems to be so. It seems the most common thing is that they change whether or not they have breasts, and that's it. Their private parts are actually way less common to mess with, and it's just more common that they change whether or not they have breasts so that they can present themselves differently.
Yeah. Um I mean, I think that the hormones are a really intense intervention when you're talking about like a psychiatric cohort. Just because like I think mentally ill people are going to be more sensitive to things like just things like birth control, like all hormones. It's really not just like high ass levels of cross sex hormones, but like I consider that to be like I'm not saying it is barred, right? But I'm saying like I don't think that's just like a lackadaisical, oh, just the estrogen pills, the testosterone shots, like um and testosterone's like more irreversible than estrogen. I would say, but estrogen is not like irreversible. Like none of this shit is like really irreversible. People focus on the
Right.
cosmetic stuff. That is like I will lament that. Like people focus and like
Well, that's
that
what you
does suck
brought up, and that's
obviously.
why I
What?
was well, that's what you brought up, so that's why I was like making an argument to the
Oh,
cosmetics,
I
is
wasn't
because
meaning to talk about you, and maybe I've done it in the
okay.
past, but I mean, like when
Well,
I say they're
okay,
not
I'm sorry.
irreversible.
Hold on, just so I
Oh,
can like lay out where we're at. Like you were saying that you said where are you
I'll mute
on
again.
like medical intervention? And I was like giving like some explanation and then you said, "Well, I don't think just having gender dysphoria is enough." And so I said, "Well, if you have like gender dysphoria, like most of the time some sort of medical intervention is what happens, but it's not going to be like changing your private parts. It's going to be whether or not you have breasts so that you can like just present differently and change the way that you show yourself or express yourself in public. But it's not necessarily that you're going to have a sex change." And so that's what I was trying to understand is if you have an issue with where people when people sorry how often people are getting this medical intervention, what's the problem? Is it like HRT or hormones, or is it like getting their penis inverted, or what is it?
Okay, well, puberty blockade is like my like the most problematic thing because I think it's actually like a fucking horror show. This whole like, oh, you completely block the male puberty and then you give them a peritoneal vaginoplasty. Woohoo. Like that's like actually a fucking nightmare. Like I can't like they cannot like doctors and parents can't consent to putting that kid on that path on the basis of a psychiatric disorder diagnosis, and the kid obviously can't consent to it. So like I'm not so like I'm not saying that the adult shit is a good or bad idea. I don't fucking know. I'm not going to pretend to, but this stunting of the development and then selling the extreme modifications to these people who are going to want them the most because their body is in this like, very different kind of state, like different from the normal people. Like I don't know how graphic we want to get, but like it's a sick like I think that's the psychiatric scandal part of it.
What the the transitioning part or
The
the
puberty blockade at Tanner stage 2, followed by estrogenization, and then typically vaginoplasty as soon as they can fucking sign away like their right to sue the person, basically, when they're 18 or 17.
hmm. So a kid who is like let's say like 13 is going through puberty, they say, "We don't think you're old enough to make a decision on whether or not to transition right now. So we're going to put you on puberty blockers to allow you to wait until you are old enough so that you're not going through some sort of like pubic process that will make things harder later on down the line. Instead, we'll just allow you to pause your body for a while and wait until you're old enough to make that decision." Do you think that's an issue?
I think that's the theory that was sold, but I think it's probably more likely that the puberty blockers mess with like a developmental process that could probably help the kid like stop disassociating from their body. Because something like between like the lowest number that I've ever seen of like, oh, the kid's got puberty blocked, how many went to cross sex hormones? The lowest number was 95%. And like typically it's higher. Like typically it's something like 99%. Like, oh, literally every other kid went on hormones. And so it's like, do you really expect like 95 to 100% of 12 to 13-year-olds to like in a specific even in a specific cohort, do you expect like that kind of percentage of those people to agree on like anything, or is it maybe more likely that this like really fucking powerful drug that literally freezes development and acts on the brain, acts on the pituitary gland, like maybe giving this to like a pediatric psychiatry cohort is irresponsible because like we don't know that it's just like a harmless pause. That's like the idea, but there's no
Where
way for us to know.
where are the drugs coming from?
Wait, you kind of froze. Can you repeat that?
Where are the drugs coming from?
I mean the manufacturers of gonadotropin releasing hormone agonists.
Yeah, like where who is pushing the drugs to get them to like overprescribe them?
I mean, actually, probably just the companies themselves. Like, I haven't done a ton of research onto this end of it, but what I do
Okay.
know is that Lupron, which is like one of the major ones, settled a big ass fucking lawsuit, and they admitted that they were bribing doctors and giving doctors money to push this on, I think, either prostate cancer patients or endometriosis patients, or maybe precocious puberty. I don't know. They have this drug used for like a number of things, but they admitted to doing that. It was like a big ass lawsuit, and I just happened to notice that when I was reading the Dutch protocol shit the other day, because I am expanding that paper, I think. Okay.
Huh?
It's like almost finalized. It's not completely finalized right now that I'm doing this project, but I almost have it. Okay, anyway, I was reading this shit the other day, and then I noticed, oh my god, thank you, acknowledgement at the bottom to, is it, I don't know who it is, but it's whoever manufactures triptorelin, which is like another, it's just a
Okay,
European
I'm sorry.
version of
This is my
Groupon.
fault. I just wanted to ask, like, normally when we get into like the companies pushing the puberty blockers and pushing Luprin and stuff like that, it almost every time I have this conversation, it gets into, they're the owners are in Israel and they're backed by Israeli money and the Jews are the ones who want them to transition. So I just wanted to clear that up, just wanted to make sure that that's not part of the argument at all. So I
That's
just
fair.
wanted to yeah, just wanted to ask real quick just to make sure. I didn't think that's what you were doing. I just wanted to double check. Okay. So the reason that I asked like why where they so okay, if somebody is having trouble with their puberty, that's normally where the puberty blockers will come in. That's normally where like the gender dysphoria comes in, is when your body starts to change into a more masculine style. You get bigger, your muscles get bigger, you start to grow facial hair, you start to get hair in other places that isn't feminine, and you start to like disassociate with your body, and that's why puberty blockers should come in. If your argument is, well, they shouldn't do this unless they actually have gender dysphoria and are actually disassociating, then yeah, of course, I think most people would agree with that. And I don't think most doctors are doing this, but we do have like lawsuits where if that is the case, and doctors do this, they are getting sued and they are losing in court. What the companies are losing, which means that the system that we have in place to fix some sort of overreaching is working, and that like there isn't a real big problem with this.
I just don't think you're gonna see a kickback from the young transitioners for like a while, because like uh they're bought in so hard. Like I swear to God, Tom, like I I don't know, but I watched I Am Jazz, bro. And like I've been reading,
Yeah.
and you can read that interview that Marcy Bowers did talking about what it looks like when they have these developmentally stunted penises and they try to turn it into an adult sized, pseudo-vaginal canal, using like the membrane that lines the digestive organs, like, and or sometimes literally the dead ass fucking colon. Sometimes they use the colon. Like,
Yeah, but that's why
it's
I'm
like
saying that they should
actually like
use
a
puberty
medical
blockers.
nightmare. Like, and you're
That's why
setting the kid up for that.
but that's why I'm saying that they should use puberty blockers to wait until they're old enough to actually make these
But the
decisions. And
puberty blockers are what ends them up with that surgical situation, because that's how you get the like stunted penile growth,
but that's
is with
only
the
over
puberty
like
blocker.
very long periods of time. Like you have to be on puberty blockers for like 4, 5, 6 years for that to actually be the case, which is the case with Jazz. Well, most kids are not on puberty blockers for that long. Most of the time, by the time they're like 15, 16, we'd say they're probably old enough to have like more of a say in what it is that they want to do, and their parents probably have a better idea of what's going on at this point to where they can also make a decision.
Well, but if they're 15, 16 when they're talking about estrogen, and they're like 10, 11, 12 when they're talking about puberty blockers, like estrogen, and also the
Yeah,
Dutch
you want it
approach
to be
specifically
under
says
4
that after they
years.
start estrogen, that they don't stop puberty blockade, they don't stop gonadotropin releasing hormone agonists until after the gonadectomy. So that's the Dutch approach. Maybe in America they stop it with estrogen, but Jazz did not get the histrulin or Supralin, like whichever fucking version of this Jazz had, didn't get taken out until the surgery. And that's what the Dutch approach says. And so I think we have reason to
Well, they
believe that a
yeah,
lot
they
of these
had
kids are not getting the GnRHA stopped until the surgery.
but Jazz's case is a very, very rare case. That's not a common thing. That is something that is insanely rare. And I do think that like their parents like overstepped with how long they allowed her to be on puberty blockers and how long they allowed her to like um because she even transitioned early too. So yeah, everything about that was really weird. For people who don't know about this, she Jazz is like a like an entertainment, like a, or like a,
A
what do you call it, a
reality TV
reality.
star that was a
Yes,
YouTuber before that.
yeah, and they and so this like TV camera
Came
like followed
out
them
at
around for
age
a while.
5.
Yes, they were very young when they started saying that they were trans and all this other crap. And then they put Jazz on puberty blockers very, very early, like before Jazz was even showing like signs of puberty. They went ahead and put Jazz on puberty blockers, and Jazz's penis did not develop and just actually like almost uh turned inside of itself like a turtle. And then when it came time to do the vaginoplasty, they couldn't do it because there wasn't enough to work with there. There wasn't enough to invert, and so they weren't capable of doing the surgery. And it was like a huge, like massive
Oh, they
problem
did a
for
surgery. Don't
they
worry.
they did a surgery, but my point is, when I'm saying that this is something insanely rare, I'm saying this is something insanely rare. Like, this is not like a common thing. Jazz is just like one rare case.
Jazz is just the trans kid though. Like Jazz is just I mean, that is not the Jazz's treatment is completely in line with all these like world renowned guidelines. Like it's
But the
completely fine.
No, I understand. No, hold on. That is not true. The amount of time that Jazz was on puberty blockers was not in line with what's normal. And there are tons of like psychiatrists and people out there who are denouncing the problems that happened with Jazz and the way that it was treated. That is very untrue. That like that
Wait,
was not
which ones, if you don't mind me asking, like
the
psychiatrists or gender doctors?
psychiatrists. So gender doctors are gender affirming care doctors. They're not necessarily going to have like the expertise in this area that psychiatrists would. But the point is that yes, like Jazz is an extreme case that is just very rare. And the way that it was treated, the way that like they came out so early, and like they were already like transitioning so early, like those sorts of
There's
things
a
are.
version of Jazz that is a plaintiff in that ACLU Arkansas case. Brooke Dennis is the kid's name, but like 9 years old. Says on the website they came out at like 4 or 5, and like they're fighting for that ability to get on puberty blockers. And the Dutch approach says you do not take them off of puberty blockade until they get a gonadectomy. And so that's no penile development before a vaginoplasty. Like for trans kids, Jazz Jennings is the standard outcome. Like that, no penile growth before penile attempted inversion, but really you're taking the peritoneum or the colon. That is like the outcome for the trans kids who are male. Like that is it. Now
um
there are trans teens who are different from trans kids, but Jazz Jennings is the trans kid. Like that's what happens to them.
I okay, so when we're talking about like kids who transition in some way, we're talking about like I want to say it's like 1,000 people, right? Like, and the people who are in Jazz's case where they're like having this work so early is like 15, 20 kids. Like, we're talking about just like we're talking about like very rare things inside of very rare things inside of very rare things. Like, it's already rare to have gender dysphoria. Then on top of that, it's already rare to be like like to feel that you are trans before you've ever even started puberty. And then it's already rare to have these problems within that that set of data. So it's like it's so small at this point that like it's just a very, very rare thing.
But it is unethical though,
Yes, I
right? So
agree. And
these
that's what I'm saying, is
guidelines
that
should probably
if they're able to sue, then
they're
yes, of
not.
course. What do you mean they're not? You've talked about them suing. I've seen tons of cases where they
Well,
sue
wait, no, I
afterwards.
wish they could. I wish they could, except the quote unquote standards of care is that W path bullshit. And they say, oh, it's super fine. Just follow the child's lead. Like, trans kids know who they are. When trans kids tell you who they are, believe them. And like, blockade at Tanner stage 2
Again,
is like, totally
you're talking about gender affirming care doctors. Those are different than like they have to go
that's
through
who
some.
runs the show now. Gender affirming care doctors. That's
No,
who
they
runs the show.
don't.
The psychiatrists are getting kicked out. I respect
Okay,
the psychiatrists too, but they're
I
getting
don't.
kicked out.
Okay, I haven't seen that. For the most part, it seems like most states are putting in regulations to where you have to go through like some sort of psychiatric help first, and then you can go see a gender affirming care if the psychiatrist agrees that this is what's best. But there's like, it seems like, yeah, most of the time there is a process in there.
So, but typically they don't see a psychiatrist. Typically they see a psychologist, and they don't answer to the American Psychiatric Association. They answer to the American Psychological Association, which has published that gender affirmative care book. And that's what I was talking about last time. And that's like, they talk about depathologizing gender dysphoria. Gender identities aren't a mental illness. Like, we don't view it like that. That's needlessly pathologizing of like a sexual minority. They're all the way in the American Psychological Association, and most of the times they seem to just need psychologist letters.
Okay, I mean, yeah, that's news to me. I would have to, because this was our disagreement last time, and when I went through it, that just didn't seem to be the case. But if you have stuff that says this,
So,
I would be happy to look at it. It seems like they are
yes.
looking at psychiatry, not, yeah. But yeah, go ahead.
Well, wait. I mean, I don't. Let me find the WPATH standards. But they couldn't recommend, or they couldn't really require psychiatrists because they would probably never get seen. Because there's like a really huge psychiatrist shortage, and like kids, like child psychiatrists are virtually non-existent, like
Well, it's not
unfortunately.
about child psychiatry. It's about people who work within mental illnesses and can diagnose gender dysphoria. That's
Okay,
what
well,
it's
but
about.
that's different though, because
No, it's not.
psychiatrists
That's
are
what
in medical
psychiatry
school.
is. It's medicine within mental illnesses and things like that.
I mean, I would agree that like not only psychiatrists practice psychiatry. I agree with that. But there is a difference between a psychiatrist giving an eval and like a psychologist giving an evaluation of a person. Because one of
But
those people went to medical school and the other person didn't. And like one of
do
those people has like
psychologists even prescribe medication? Like, do they work in medicine?
I do think that there are some psychologists that can do an extra thing and then be able to
Sure,
prescribe.
but an
But
extra
but
thing,
psychologists
yes.
don't go to medical school.
Right. That's what I'm saying is when we're talking about people
Psychiatrists
who
do.
right, well, exactly, and that's what I'm saying is that when we're talking about people who are going to diagnose something that needs some sort of medical intervention, we're going to be looking at psychiatrists, not psychology.
Yeah, but I don't think that they have to see psychiatrists. I think they need letters from psychologists.
Mary said, "I don't think children should be psychologists." Thank you.
Okay,
That's
so
yes, very true.
I'm trying to pull up the SOC 7 right now. I'm gonna be good faith because the SOC 8 is just like actually batshit. And the SOC 7 was also kind of batshit, but like the SOC 8 just ran laps around it in terms of like crazy. Okay, so page 10 of the WPATH SOC 7. We can see what this is talking about assessment. Um, I'm trying to just find the recommendations where it's like, this is what you need before you give
They're going to
full
differ state by
psychology.
state, but it seems to be the norm that more and more we're putting into place psychiatry, and also it seems that most doctors are going to require some sort of psychiatric evaluation before you're capable of seeing the doctor afterwards.
Um, so okay, they require the letters. It says mental health professionals. So that's going to be probably, I can't find the like definition of the term right now. I could look, but it seems like that's an umbrella term for like
It is,
uh
but we're talking about medicine. Like again, we're talking about somebody who needs medicine. We're talking about somebody who needs to practice medicine in order to even like be to even
psychologists.
qualify in the first place.
I really think psychologists can give people their letters for shit. I wouldn't like bet my whole checking account on that, but I would bet like $40 that like at least it again differs state by state, but
Mhm.
I think in a lot of these places you can get just like a garden variety therapist, like or even like a social worker who's like taken a couple gender studies courses and like gotten a certificate, like one of those CLE, like continuing whatever their version of that is. Like, I really do think that at least in like some of these like big blue cities, like you really can just like waltz in and like tell them like, oh, I'm feeling this way, and they're like, yes, affirmed, because you can read that. You said if you have any documents, so introduction to the gender affirmative model. by the American Psychological Association, who licenses all the therapists in America. So not the psychiatrists, but the therapists. That document like depathologizes gender dysphoria. They're very opposed to viewing gender identity as a mental illness in any context, and they say that. And they say like it's our job to just follow the lead of the patient, which is like typically not the job of the mental health professional.
No,
So it's
yes,
just
it
really
is.
bizarre.
That's why earlier I asked you how they would know whether or not somebody has gender dysphoria is because they can only go off of what the person is telling them. They have to get that information verbally from the person. They can't just do some sort of brain scan and be like, "Oh, yep, you have gender dysphoria. Here you go." Like they have to actually talk to them. They have to go through conversations. They have to understand the like the what's causing this and what the outcomes are, like what the side effects are. Like it's all going to be based on what the person is communicating to them.
Well, see, but I wasn't able to spot this line before because when I was in the waiting room, I was like, oh, I should look that up and like try to get like citations. But I like remember in this oh shit, I just completely forgot what I was about to say. Oh god, but I remember in this document there was like something that you said like, oh, I don't think we see that, and I was like, dude, I literally saw that in this document, but I forgot what it was.
Well, hold
Sorry,
on.
I'm kind
Well,
of
you
drunk.
just said a
I'm not gonna
second ago
lie.
that you think it's wrong that they are going off of what the person is telling them, and I'm saying that's
Well,
the
no, no,
only
no.
way that
I think
psychiatrists
that gender
can work.
dysphoria is not enough. I think you need extreme, persistent, treatment-resistant gender dysphoria, and
That's what
like,
gender
I
dysphoria
don't think
is.
they. Oh, I was about to say.
Hold
You
on,
said they need
hold
to
on,
figure out.
wait.
Oh, sorry.
Hold on. I'm sorry. Hold on. When you are saying that, you are talking about gender dysphoria. Gender dysphoria already is a strong persistence within this area to make it a mental illness. Everybody has some small problems with the way that they present, with their gender. They want to be more masculine, less masculine. Like everybody has some small problems with these. But once it gets to a like strong, persisting issue, that's when it becomes a mental illness. That's when it becomes, because I think a mental illness is even something like within your brain that makes it harder for you to be able to engage within society. So it's not even at the level of mental illness until you have problems engaging within society. The part where you're saying it needs to be there first, it's already there in order for them to be diagnosed with gender dysphoria.
Um, well, the DSM-5 criteria takes it says something like 6 months, right? Which I don't think is anywhere near. And for the record, I don't think that this is like a good idea to do. And minors, like you can't be messing with these people's development before you sell them these surgeries. And the minors whose development are messed with, like have to, at least the males, they have to get the surgery because they can't like the alternative for them is like they don't see it as an option. I understand why. Again, I don't know how graphic you want to get, but like that's like that has to be illegal. Like that shit is like evil. And these everybody
What?
like you
Hold on. Go
all
ahead
these
and get graphic.
organizations.
What are we
What?
talking about? Go ahead and get graphic. Like tell me
Okay, so
what are we
these
talking about?
kids who have their dick growth stunted when they're basically Tanner stage 2 is what it's called, which is like the second you start puberty, they're allowed to give you a actual chemical castration agent. That is what all these GnRHAs are. They give you that, your dick stops growing, and then they're 18 and they have to decide, do you want to have a child-sized dick? Do you want to get off these drugs and masculinize and not know what changes are going to happen? Or do you want to get this insane, fucking unhinged, like highly experimental, they don't know what the fuck they're doing surgery? Like
Yes,
that is
again
just an
though,
abysmal
we
set of
that's why
options. Like you
we're
can't
going
set people up for
backwards,
that.
Allie. We're going backwards. Like this is why earlier we were talking about the fact that we're already talking about a minority within a minority within a minority. Like that's such
But
a
how is
small
that
group
not
of people.
illegal? That's like the foundation of all this research is doing that to people.
Because it that okay, so when you're talking about something being illegal, like there has to be like some sort of spectrum on which doctors have the ability to make decisions based on different criteria, different information, and sometimes that's just what's going to happen and it's really bad and it's like it's very freak, scenarios where this is the case. But when we're talking about this again, we're talking about like yeah, like a very very like small like 10, 15 people. Like we're talking about such a minute group of people to where we're not pointing out any major issues within the industry. We're just pointing out freak accidents that happen sometimes that are accidental.
Uh, it seems like most of these studies, though, like the ones that are praised as the best ones, are done exclusively with these cohorts. that like were brought in super super young and then just medically stunted as soon as they could be. And these people, I'm not gonna lie, they have the most cosmetic success, and they will parade them around and be like,
And
look how beautiful they are.
what
But
age
like
are they transitioning at?
they're basically getting puberty blocked as soon as they can, and then they go on estrogen as soon as they can, and then they get the surgery as soon as they can. So that's like between 10 and 12 for the puberty blockade, between
But that's
14 and
what you
16
want.
for the estrogen, and between 17 and 18 for the vaginoplasty.
Hold on, but
Seems
that's
like what the trans kids go through. That's what Jazz Jennings, Nicole Maines, like all these kids who come out and they're like, I was one of the Boston children's kids, like the pediatric, like hotshot, like Harvard teaching hospital, like that's what they were doing. Like all this like the research that's like, oh, you see, like that's the research that supports this. It's like done with these kids. Like so maybe it's rare, but it's like this is what the knowledge base is based on. This like what I would say is like highly unethical shit. And the teenagers, it's like, well, we don't even know what the fuck we're doing with them. Like, at least they don't go into these surgeries with this fucking, like, or not even these surgeries, but at least they don't go into adulthood facing this,
okay.
like, literally unwinnable choice.
Hold on.
But, I mean, they are, like, it's a shot in the dark for them as well.
Jazz Jennings got vaginoplasty at 16, and this is what I'm talking about. Like when we're talking about the time frame from when you go on puberty blockers until you
I thought
start
Judge
to,
James was 17, but I don't
it
know.
may be 17. It's all I see is that there's a article that was written in 2019. They said in 28, or sorry, yeah, in 2018. So she was 19 and 20. Yeah, it doesn't matter. You like, you might be right. There's a range there. But the point is that um, the amount of time that they're on puberty blockers is what's causing the problem that you're upset about. There's nothing else except for the amount of time that they're on puberty blockers. That's it. It's just the amount of time. And that's what's causing the entire issue that you have a problem with. And like I'm saying, like you're saying, like, well, it has to be illegal for this to be the case. It's like, well, I don't know, because I think it's probably good to have them on puberty blockers to some extent, but then also I want them to wait as long as possible before they get some sort of like very serious surgery. And so sometimes it sucks that there are like negative outcomes that come from waiting longer, but waiting longer is a good thing. That's what we want, isn't it?
Every single document I read that's like this is the protocol for puberty blockade and transgender adolescents. It just says you puberty block them until you cut the testicles out, like the
Yes,
gonadectomy. Like that's what it
that's
says.
true. That's true, but you're saying that, hey, look, they waited too long, and then Jazz Jennings had problems with their gonads. And
Well,
I'm
that's
saying
inevitable with
we
trans
want them
kids,
to
right?
wait.
Unless you're selling vaginoplasties to fucking 14-year-olds. Like, is that what you're suggesting? Because that's
No,
the
no,
alternative
no,
is
no,
that
no,
you
no,
puberty
no.
block them
Hold
at
on.
like
No, it's the opposite. I'm saying you and I want them to wait. We are happy that they are waiting longer before they make these super serious decisions. But you're saying, look at the bad outcomes from waiting longer. And I'm saying, yeah, there are bad outcomes from waiting longer, but we want them to wait longer. So there are going to be negative side effects from waiting longer, but that's what we want. We want them to wait longer before they make these serious decisions.
waiting longer is the issue is that they're not developing. They have to develop. It's not just going along in like this like weird quasi frozen state of development. They need to like have bodily tissues develop that frankly they don't want to develop, because in order to get penile growth you have to have bodily masculinization in general. You can't just isolate it, right? You can't just isolate the effects of androgens. And these
All right.
kids have been like, these are the kids who quote unquote came out. I mean, Jesus fucking Christ, but came out at like 4, 5, 6, excuse me. And so they're like, you know, they've been basically brought up by their parents to be like, oh, the worst. I mean, they lived the life of the trans kid. Like they've been justifying this to everybody they've known. Like they're like, oh, puberty's the worst. Like you with Jazz was so coached to be like, they ran Jazz around because the health insurance company didn't want to pay for the puberty blockers. They took this kid on like a media tour, and they were like, it's just going to be the worst thing ever if like a single drop of masculinization hits this child. Like it's literally like this child just might fucking kill himself if like a single masculinizing thing happens. Like there's so much hysterical frankly rhetoric about like cosmetic changes. And like I do, sorry, my dog is grunting in the background, but like I do feel bad when people's bodies change in ways that they don't want it, but it's like the the cosmetic freak out is justifying this keeping them on puberty blockers for like longer than I think. I mean, I don't know. It's hard to track in the
Okay.
US because we don't have a centralized thing, but like I think these kids are typically on puberty blockers for like 5 to 6 years, the trans kids. That's what it
Okay.
seems like it is.
Okay, I feel like you're talking past what I'm trying to get at. So just
Sorry,
real
I'm not
quick,
meaning
I'm
to.
gonna.
I swear to God.
It's okay. I'm gonna lay this out, and I want you to just give me a yes or no as simply as you possibly can. Okay. So one, we are okay with kids being put on puberty blockers to some extent. Yes.
I don't even know anymore, man. I don't even
Well,
know anymore.
ignoring all of the other things that you just talked about, would you be okay with a kid that we know has gender dysphoria and we believe that this will at least help repress things until later on they decide to get surgery? Yes or no, are you okay with kids being put on puberty blockers to some extent?
I don't have there's like one potential case where I might be okay with it. And like it's specifically the like honey, stop it, Andy. The like kid has been in the system, like specifically like androphilic male has been in the system, like psychiatric system since like 6, and they've been monitoring this kid, and then you just see like insane fucking anatomic dysphoria start happening as soon as puberty happens, and they're like literally in and out of the psych ward like dying. Like it would have to be like that fucking dramatic. I'm like, okay, maybe. Like if you've basically declared the kid like to actually be like terminally a danger to themselves to where it's like you're just throwing anything at the wall, maybe. But like I don't even know that it's ethical to declare a kid that far off. So like I
Okay,
really don't know if I'm ever okay with it.
what about a person? Okay, so yeah, so that's the issue then, because I feel like you're skipping a lot of steps when you start talking about like the penile growth and all this other stuff. Your issue is just that they're being put on puberty blockers whatsoever. So would you feel
Well,
the
I
same
think
way?
the fact that that has happened to people shows how crazy this shit is. Like the fact that that's happened at all, like, and these kids can't sue because there are these globally like recognized like standards of care document that people are fighting in federal courts all over the country to uphold. They like won't be able to sue for getting these crazy fucking results because there's just like a recognized document that like the fucking Biden administration is writing briefs in favor of that says, yeah, this is the standard of care for trans youth. So like that is an enormous problem. Like even if it's rare people, they are set up to have no remedy in medical malpractice law.
Okay, I'm just telling you, there are people who sue because and win because the doctors were negligent in the way that they treated this and they overlook things and they rush things. But there's like again, these are rare cases, and so yes, people are suing, people are winning. It's even happening in like Europe. There's like a couple of cases there right now where there were gender affirming care units that were overly prescribing things and pushing things too quickly and just saying, oh, you think you have gender dysphoria, then here you go. But those are rare, and those are the places that are getting shut down, and like they are getting shut down when this happens. So it seems to be like something that's not standard. But when I'm bringing this up, the reason is because it sounds like you're saying yes, like so I would say yes, I want them to be put on puberty blockers so that they can hold off on puberty, so that if they do have gender dysphoria, they're not so far along in puberty to where they have to have just an insane amount of work done. Like they have to get their jaw changed now, they got to get their penis changed and inverted, they have to like change their like there's just way more
Inversion
things.
is the best for outcome though. And I mean that fucking sucks, don't get me wrong. Like most that fucking sucks, but like that's literally the best outcome is to be able to perform a penile inversion.
Right, but
I mean, the
hold on.
best outcome would be
Wait,
to, like,
hold
get
on.
the person.
Wait, no, come on. What, Allie? My entire issue here is that they're doing it too early. My entire issue is that they're making permanent changes to people's bodies too quickly, and you're saying no, do it quicker, do it faster.
Wait, no, I'm saying you can't do a penile inversion at any age if they've been like truly puberty blocked because there's
Yes,
nothing
I
to
know.
invert.
Hold on. Okay, so
Okay.
this is what I'm trying to get at is we want them to go on puberty blockers to some
No.
extent to hold off. I want them to go on puberty blockers to some extent to hold off on them getting any sort of like major surgeries done, so that they can wait until they're old enough, until they've had enough
But
like
puberty
psychiatric
blockers
help.
makes them have to get a surgery because
You
if they have
again,
like a
no,
fully
that's not
developed
true.
dick, they have
That's not
if
true. It's
they
not the
have a
puberty
baby market
blockers
if
in
they
and
have
of
an actual
themselves,
dick.
Allie. Allie, it's
No,
not the
wait,
puberty blockers.
to be graphic again, there are kids that say, "Listen, if I don't get this fucking surgery, the only people attracted to me are pedophiles."
Okay,
But
hold
like,
on.
if they
Hold on,
have
hold
a
on, hold
fully
on, hold on,
developed
hold on.
penis, they don't have that psychosocial problem.
Hold on. You're not listening. Okay. The puberty blocker in and of itself is not the problem. It's puberty
Yes, it
blockers
is.
over.
Yes.
Allie, chill. Okay. Let me get through this. The puberty blocker is not the problem. It's the puberty blocker over long periods of time that stunts the penile growth too much, right? Whereas if you have them on puberty blockers and you have them getting psychiatric help for like 2 years, the psychiatric help should be able to decide whether or not you have gender dysphoria at that point and whether or not you should transition. 2 years, right? 2 years. That's good. That's okay. 4, 5, 6 years, then we're getting into like Jazz Jennings territory where yes, you're going to have major issues now. But 2 years? No, you can use puberty blockers for 2 years.
It's puberty blockers followed by cross-sex hormones is like kind of it's basically I mean, it's not the same effect because those puberty blockers are so powerful.
That's
They're
not always
literal
the case.
anti-testosterone
That's not
agents.
always the case. They again, you're skipping steps here. There are one, you get put on puberty
Most of the
blockers
kids
to
go on to hormones.
okay, you get put on puberty blockers to hold off on the puberty, right? Until they decide that yes, you should start transitioning. Then you get things like HRT where now you're getting estrogen or
That's
hormones.
95 to 98% to even 100% of the kids, right?
Yes,
So
because
it's not
most
like
likely
there's
they
just a
have
ton
gender
of kids being
dysphoria.
filtered out, right? So
Yeah,
it's almost like when they sign up for puberty blockers, they're signing up for the whole thing because it really just seems like
no,
the trap doesn't stop when you
Allie,
get on it.
you're killing me. You're ignoring like part of what I'm saying. They okay. This is okay. They're getting put on puberty blockers. While they're on puberty blockers, the psychiatric help is still deciding whether or not they have gender dysphoria and what they need to do to go to further this process. You would assume most people, if they're saying yes, you need to get on puberty blockers, it is most likely that they have gender dysphoria and that they are going to continue the transition. So everything you're saying, yeah, of course, no doubt, they're most likely 80%. Yeah, that means 20% of people are saying, oh, hey, you know what? Like, let's wait longer, or I don't actually have gender dysphoria. Let's try something else, or let's figure out what else is going on. That is what you would expect.
Okay, so this is just more and more people with these like, developmentally stunted bodies being sold these like unhinged genital modifications. Like, which is like I think the bioethical problem of all this, and where psychiatry has like blood on its hands for allowing it with its book. Because
What is
I
it?
mean, like
What is?
psychiatry, when they changed it from gender identity disorder to gender dysphoria, they made it billable because gender identity disorders had been specifically barred from disability coverage in the Americans with Disabilities Act,
Yes,
which I think was kind of bullshit.
but that's
But
where we disagree, and that's where we disagreed last time as well, is whether or not that's actually the case and whether or not they're actually using the the psychologist book and not the psychiatric book. So that's
well,
like
no, the psychiatric book is where you get gender dysphoria.
right,
But the
and that's what I'm
psychological
saying is I believe that they're using the psychiatric book, and because it has to be a psychiatric book in order for them to like engage in medicine. It can't be a psychologist.
Yes, exactly. But what I'm saying is that the psychiatrists themselves, despite putting this like in their book, they aren't super involved in it and they've just kind of like signed off on it. Like I do think it's mostly psychologists and endocrinologists and some like plastic surgeons who are like really like pushing this the hardest. Like I don't see there are some psychiatrists. Jack Turbin is a psychiatrist. He runs around testifying at these cases. Okay, so they do have some psychiatrists in their court, right? But you see a lot of psychologists, like a lot of psychologists, a lot of sexologists, like not so many psychiatrists. Just gonna say that.
Okay.
Which I mean, nothing against the sexologist. Like Ray Blanchard is a sexologist, and he and Ken Zucker was a sexologist who wrote the fucking gender dysphoria chapter, and they burnt him. So that is what it is. That's what I'm saying. Like the fact that Ken Zucker got burnt shows you that they're moving away from the psychiatric model, and the psychological book says. We don't view it as a mental illness. Like gender dysphoria is a DSM-5
No,
condition, but gender
no.
dysphoria lowercase is something that anybody can experience.
No, he was out there. He was like completely denying like that gender dysphoria existed almost whatsoever. He was pretty far outside the bounds. That guy was
Ken
nuts.
Zucker?
Yes.
Ken Zucker that wrote the fucking chapter of gender dysphoria in the DSM-5 and who gave puberty
When?
blockers to
When did
people
he
at
write it? When did he write it, Allie?
he was the chair of the
When?
DSM-5.
When?
It was published in 2013, I guess. But I mean, I'll
Yes,
like.
we have made so many advances since then. Everything has changed. We know so much more now. We have
Wait,
made
do we know so much more? Because
yes,
I
he is way behind. He was way behind and he refused to
okay, so
evolve
you're just
and
with
change his
the
ways.
activist then. You're not with the psychiatrist then. Like
No, I am with the psychiatrist. He is not with the psychiatrist. He was the one who would not actually change what it was
he
that he was
wrote the
saying.
psychiatric manual,
It
dude. How
doesn't,
is he not with the
yes,
psychiatrist?
he wrote it a long time ago. And when we got more
In
advances, we got more
2013, a long
information.
time ago in 2013? That's not
It,
that long ago.
how many
In terms
trans
of
people have you
psychiatric
ever heard of
knowledge.
in 2013, Allie?
What?
How many trans people have you heard of when you were in
They
2013?
have been giving these treatments to people in America since like the
How
60s,
many
50s.
trans people did you know of in
Just because they didn't have
2013?
media representation doesn't mean it wasn't a psychiatric phenomenon. This shit has been in the manual since 1980.
The point is that there were almost none because we didn't have the advancements that we have now. We didn't know nearly as much back
Or
then as we do
because it
now.
wasn't in the media so much and because it's like socially
Oh,
contagious.
really? You think if we look it up right now that there's not going to be way more transitions today than there were a decade ago? That's what you think?
Well, absolutely, I think that.
Yeah.
Yes.
Yeah, because we know a lot more. We've made so many advancements. When I asked you
Okay.
how many trans people you knew
What
in
are the
2013,
advancements? What are the advancements?
we understand what gender dysphoria is now. It's in the like yes, it being in the DSM-5 got us a lot more research on it, made us understand the brain differences a lot more.
No, not really. It's kind of the same shit as the DSM-4 and the DS. It's just they changed the name, and there are some little differences. But like, you can go through the psychiatric manuals, and they've never. I mean, you say brain differences. I know they look for neurological bases of all the mental illnesses. Sure, they've never found them. That's why they're mental illnesses and not neurological issues. Like, there are no biomarkers to these tests. It's like these are feelings diseases. You know what I mean? And so, uh these are pretty intense treatments for feelings diseases. And the knowledge base, I don't think has changed as much as you're saying it has. Like the phenomenon has changed a lot, but has the knowledge base changed a lot?
okay, when we're talking about Zucker, we're talking about somebody who had old like old information and refused to progress with what science was saying about treatments, and he didn't progress with the DSM-5 with
He
what
wrote the DSM-5.
he
How do you mean
wouldn't
he progressed with the DSM-5? He wrote it. He is the
he
DSM-5.
hold on, he helped write it. He did not, when it came to what the prescriptions were, he would not evolve with that. He would not change with that. He stayed very like stringent on not allowing people to transition.
Wait, what prescriptions? The DSM doesn't really like prescribe treatments. It just describes diagnostic conditions. It doesn't really like say
Um,
this is what you should do.
well, the name changed because the idea of what was happening changed. So gender dysphoria, um, what did he call it again? Um,
It had been called gender identity disorder before, but he only chaired the time that they changed it to gender dysphoria. He was on the group when it was called gender identity disorder. Before then, it was called transsexualism.
right. Yes, this is what I'm talking about. Yes. He refused to evolve with it like being changed to gender, with it being changed from sex, with it with the types of like treatment that people need for these things. He refused to progress with the rest of science.
I mean, he gets shit on by the turfs because he gave people puberty blockers. He just thought that the Dutch model was the only evidence-based way to give out puberty blockers, and he didn't think that you could just be given cross-sex hormones to like what's been dubbed the ROGD like cohort of teenage females, but that he totally did give puberty blockers to the childhood onset gender dysphoric females, and he totally gave them testosterone. So
Yes,
he
but
gets
he was
shit
also
on from the other
using
side too.
no, he doesn't get crapped on for giving them puberty blockers. He gets crapped on because he was using tactics like conversion therapy type stuff to push people back to their original genders. Like he
Okay,
was
as
out there.
kids, he totally tried to. And for the record, uh, I don't think he was doing aversion therapies. Right? He tried to like encourage gender neutral stuff, and he tried to encourage like same sex relationships. But yeah, he says like, listen, if we can do these like largely harmless things in childhood to avoid this medical outcome, like absolutely, like he'll give the puberty blockers to people, but like it is pretty intense to chemically castrate a person as soon as puberty starts because they fucking feel bad about their body. Like that is
Yes,
a
I
really,
agree,
really
but that's
insane thing to do.
the
So it's like
reason
if you
that
said
he got
doing that at all costs, it's like I don't see how we feel comfortable calling that conversion therapy. That seems like a little extreme to me, but
No, it wasn't. I'm not saying that he was like actually doing conversion therapy, that he was using conversion therapy type tactics to try to get people to detransition or to go back to their original gender. And the issue wasn't that he was trying to do that whatsoever. The issue was that he was ignoring like what it was that he was ignoring side effects from what it was he was doing and continued pushing farther and farther anyways, causing detrimental effects to his patients. I like this guy actually had a lot of issues in the ways that he was treating people, and he was I forget if he got shut down or if he just I'm pretty sure he quit, but he quit
no,
before
he
he
got
got
shut
his
down. He
license
got
taken
shut
away,
down.
right? So
He
yeah,
got
so
shut down and he won some case against newspapers. But like all these
yeah, but
allegations that have been launched against him, it's like with all due respect, like are there any names? Like are there any like people who took him to court? Because there was a lot of like unnamed sources in this like random like basically like Canadian gossip rag like
it wasn't though.
right
It was
there
an
like
actual
all these
like
people are
internal
supposed to get him in
investigation. It was an investigation by the government where they were actually like checking the way that he was treating people.
by
It
the
wasn't just
government
some
or by the hospital.
it was I want to say it was the government that this was reported to, and they started doing an investigation, as did the hospital, and the hospital ended up firing him before the investigation was even over because the hospital came to conclusions that he was doing the wrong thing anyway. So it was
Well, so wait, what happened to the government then? Because I
I'm
don't
pretty
know
sure
that
they
I
took
don't
his
think the
license
government
away.
ever like got involved.
I could have
Because I
sworn
don't
they took his license away.
know. Because
No?
whenever I was researching, he was still in private practice, and this was years after it happened to him.
It's been a
I
long
don't know, and
time.
like he could well be retired now, but I do not think his license ever got taken away. His clinic got shut down. His clinic
It's
got shut down. And he got fired, and they denounced him. By they, I mean his hospital. But I mean, if I click on his name right now, I like
yeah, maybe
still.
maybe I'm wrong. It's been a long time since I've looked into this, so I might be wrong about that. But I do remember I didn't so
It
I went
seems
over
like he
this
still
with you.
practices in Canada,
I went over
but
this
he
with
accepts
you.
referrals from the US as well, so it seems like he's still able to practice.
Okay, I went over this with you, and I remember as we were going over the things, we could see like unethical things that he was doing, and you would even say, "Oh, I don't necessarily agree with that, but blah blah blah." And it's like, well, this is why he's in trouble. It's over stuff like this. Like he had areas where he was
The
obviously
most
just
controversial stuff oh, sorry, you go.
no. Go ahead, go ahead.
The most controversial stuff was, I think, from the early to mid 2000s, he would, like there would be toys taken away. And this was not like with the intention of making them super gender conforming, allegedly is because these kids had very like obsessive compulsive traits about their like toys, like the kid who liked dolls a lot, like they would take the dolls away, which has the appearance of, I mean, making it look like you're trying to make a boy more masculine, but in reality this kid was like oftentimes like either autistic or obsessive compulsive, but they literally never talked about anything other than dolls. And so it's like you are trying to take away the like trigger, if you will, that gets them onto this like hyperfixation talking kick. Now, some people will say that's bullshit. They were concerned with gender conformity. That's like a post hoc justification. I tend to believe them. Like I don't know. Like I watched a documentary about him, and I have watched documentaries like opposed to him. I like land on his side, even though I think that it's unethical for him to have given these treatments to anybody knowing the medical result, because he like had to know what happens when you give puberty blockers this young and they keep going. And we both know that most of them keep going, right? Because they're so accurate at diagnosing it apparently.
Allie, you have
But
to
that
know
like
your
slits his
jumping
throat and
steps
then
when you
keeps
say
going.
that. You have to know you're skipping so many steps when you say that. Like,
What's the
if
step that I'm skipping? Wait, what's the
if
step
the
that I'm skipping?
issue is not giving puberty blockers, it's what happens after, then you need to talk about your issue being
The
with what
issue is the
happens
whole
after, not the
thing.
puberty blockers in and of themselves.
You can't isolate any one thing, though. It's the whole medical carousel. It is the chemical castration, and then it's the administration of cross-sex hormones, so you ensure atrophy of all the fucking sex-based reproductive organs, and then it's the like crazy insane surgeries. It's that
Yes, but you
combination
keep
of things.
saying, yes, but it's not. You keep saying, well, if they just gave them like puberty blockers and didn't do X, Y, and Z afterwards, or if that didn't mean that they were more likely to get this done and then that done, then it wouldn't be that big of a deal. Then you should be like, hey, don't do X, Y, and Z afterwards and just give them the puberty blockers and do something else afterwards. But you're not. You're just saying, well, it's more likely that they're going to do this if they take puberty blockers, so they just shouldn't take puberty blockers.
If there was some knowledge that like, okay, if you don't give them puberty blockers, like a ton of them are gonna go on to like atrophy their reproductive organs before they can drive a car and then get their like genitals cut up before they have like or before they're 18 years old. But if you give them puberty blockers, they'll like all desist. But it's like obviously you would give them puberty blockers with the assumption that they're gonna stop like with the body modifications and they're gonna like
No,
let themselves develop
no.
healthily and go on.
Puberty
But like that
blockers
doesn't
are a
seem to what
pause
happens.
button.
It's the exact opposite.
Puberty blockers are a pause button. People have to go through some sort of puberty at some point. They have to go
Wait,
through some
no,
sort of
they
puberty.
don't. Wait, okay, I'm sorry. Giving a chemically castrated male estrogen is not going through a female puberty. Giving a like pseudomenopausal female testosterone is not going through a male puberty. These
What do you
kids aren't
mean?
developing. They're not going through puberties. They're getting drugged. Like that is not like the body developing in response to hormones that the brain is releasing. It's like not the same thing. This is
What do you
sci-fi.
mean? What are you
What do you
talking
mean?
about?
What do you mean?
That
What do
is
you mean?
literally what it is.
No, it is not. That's like a theoretical thing that they do where they're like, we just view giving them these drugs like it's the other, like puberty. So we're going to call it that because it's like kind of like that. But no, it's
No,
not that.
Allie, they like freaking grow boobs and everything. Like their body changes. They
Yes,
grow
yes,
more
they get
hair. They get bigger.
gynecomastia,
They bulk
They
up.
get
Like,
gynecomastia. That's what they get. They get female type breast tissue on a male. That's
no, hold
gynecomastia.
on.
That's
No,
not
no, no.
female
Hold on, hold on, hold
puberty.
on. Is somebody who gets puberty blockers early on and then starts getting estrogen will naturally grow breasts.
Yes.
Yes. Okay. They will also their penis won't grow. They'll like grow less hair. They won't grow facial hair if they're getting estrogen. Like all if they're getting testosterone, they will start to grow facial hair. They are going through puberty.
Well, no, their body is changing, but I don't think that's going through puberty because I think going through puberty is like a whole brain and body process.
It is. You are correct. But the sex is not changing. And this is something that we keep having to go over is that they have a problem with their body. And so when we're saying we hit the pause button with puberty blockers, and then eventually we decide which puberty they want to go through, and then we have them go through that puberty. You are correct. There are other aspects about the brain that will not change, and it's not like their brain is just going to naturally produce these hormones. But their body is changing in the way that they need it, and that's why it's like it's dysphoria. They have a problem with their brain is disconnected from their body, and so we don't need to change their brain. We need to change their body.
That's okay. So this is the only part of psychiatry where we're like, oh, the mentally ill person doesn't like their body. Just fuck with their body. Like we don't do that in any other area. Like that. Just can we admit that?
No, that's not true at all.
We don't
We
do
have
that with anorexic people, and there are people with body integrity dysphoria, Tom. Body integrity dysphoria, and we don't cut their healthy limbs off. And that's in
wait.
the
No, hold on. No, no, no,
11,
no.
which is
Wait,
the UN version of the DSM. Thank you
no,
very much. It's a real thing.
Allie, that is not the same thing. Yeah, of course you're not going to cut their limbs off if the limb isn't the problem. If somebody has body dysmorphia, yes, we make changes to their body so that they have a healthier view of themselves. If they have anorexia, we try to get them to eat better. And
prescribe them a nose job.
if they have anorexia, we try to get them to eat better so that they can gain weight. If they're gaining too much
We don't
weight
give
and
them
they're too fat, we try
liposuction.
to make them lose weight
We
and
don't
diet.
affirm their We don't affirm their hatred of their body. We don't give the anorexic person liposuction. We don't give the person who wants to cut their arm off an arm amputation. We try to change their mind. We try to change the way they relate to their body, themselves. We try to change their mental perspective.
So you're
There's
advocating
only
for,
one area of psychiatry where we start changing the body because the person feels a certain way, and that's trans.
yes, so you're advocating for conversion therapy.
No, what?
Yes, you are. You're
No,
saying
wait, why do
don't.
you feel so comfortable comparing them to gay people, Tom? Because gay people don't need drugs or surgery.
I'm not
and
talking about gay
actually
people.
are on a mental illness.
I'm not
So I don't
talking
know
about
why
gay
you feel
people
so why are you using the word conversion therapy?
because
That's like a
you're.
term used for gay people.
It is used for gay people because it's the same process for both trans and gay people. I'm talking about
Are people
conversion
like
therapy.
electrocuting the trans kids so that they don't want to get chemically
It doesn't
castrated?
have to be electrocuting. There are tons of different ways of using conversion therapy. Conversion therapy isn't unethical just because of the process that's being used, but it's because you're not understanding the way that their brain is actually functioning, and you're trying to change the like their brain instead of actually like listening to what it is that they're going through. So if somebody says they're gay and you try to make them straight instead, the problem is that you're just not trusting that they're actually gay. If they're trans and they're saying, "Hey, my brain, I have gender dysphoria. My brain says that I should act like a woman."
So trans and gender dysphoria are the same thing.
What?
Are trans and gender dysphoria the same thing?
No, of course not.
Well, then why did you just use that interchangeably? Because like this isn't
Because somebody
conversion
who's
therapy is it's not like somebody tells you that they're trans and then they're like, "Oh, well, okay, here's time for your gender affirming healthcare," right?
okay. Sorry. Sorry. I'm saying if somebody has gender dysphoria, they should probably transition, and if they transition, now they are trans. So I'm saying like conversion therapy is the denial of the actual state that their brain is in and trying to force them to be what we would call normal.
I think it is well, wait, I don't really care if that it's not the trans identity, it's the body modification. I think it's insane to call trying to convince a kid not to like want them to change their body a lot to call that conversion therapy. Like the kid is literally begging for extreme body modification. You're like, "Hey, please accept yourself for who you are and how you are." And y'all are like, "That's conversion therapy." Like, does that like not feel a little bit Orwellian to you?
If yeah, well, what's Orwellian is using like trying to force them to like just accept that they're different and then not giving them the treatment that would actually help their mental health.
Wait, to a
That seems
person to
Orwellian.
develop healthily instead of get chemically castrated and then have their developmentally stunted genitals like obliterated surgically?
You're saying healthily. I think getting them to transition is what's healthy. I think that getting them to have a better mental
Well,
process
the
is what's
transition is
healthy.
taking like objectively healthy tissue and giving it drugs that destroy it. So it's literally not healthy, right?
Wait, what?
That's what
What do you
transition is. You're when you give like a female testosterone, her female organs will atrophy. This is where you can hear things like incontinence, vaginal atrophy, because these people are giving themselves geriatric reproductive systems. They're inducing menopause, basically. These are like 25-year-old female people who are going through menopause because they want to present as men, quote unquote. And so, like, that's what I
Mhm.
mean when you're taking a healthy person and you are inducing physiological issues, like, you are just actually doing that,
You're
like, in
calling
the
it an
name that
issue. I
their
haven't heard
body
the
is
issue yet.
wrong, that their body has to match their mind.
Yes, when you say issue, I'm assuming there's some sort of negative here. Like, and I'm trying to find the negative. Where is the negative?
What do you mean the negative?
Like, where's the problem? You said an issue. I assume you mean a
Like
problem by
taking
an issue.
testosterone?
Like, what
Uh,
is the problem?
Yeah, so the clitoral growth sounds extremely fucking painful, and the perhaps like potential incontinence sounds really fucking painful from vaginal atrophy. And if you
Mhm.
ever want to have penetrative sex and not be in excruciating pain, it's like probably a good idea to not induce pseudomenopause in your 20s. Like that's
So,
just probably true.
okay, so
So
this is one of the problems that I get into with almost everybody who talks about trans issues on the other side. Like anytime we're talking about some sort of medical treatment, we're almost always weighing benefits versus the negative. So when people who like don't want to get the jab are saying things like, oh, well, look at all these negatives, blah, blah, blah. They're never weighing them versus the positives. They're just looking at the negatives and saying, look, there's negatives. That's what you're doing right now, where you're just looking at negatives and saying, look, there's negatives from this. But we weigh those versus the positives, and then people decide whether or not that's worth it, like on both sides.
Okay, I mean, yeah, that's fine. I just think it's crazy to be like, oh yeah, this one special area of psychiatry where we just inexplicably body modify instead of trying to change the person's perception of their body. And we just take away sexual function and genitourinary health, and you just weigh the options. And there's just this like one super special area of psychiatry, and it's just really politicized. But ignore that, and woohoo!
Okay,
Like that's not
so
satisfying to me.
when I say that they should go to psychiatry first, right? I'm talking about the fact that like somebody needs to actually decide that they do have gender dysphoria, which means that this is like unchanging. Like we're not going to be able to just like, like, show them a bunch of images or like get them to like go back to what we would call normal some way. Instead, like the what's best for their brain is we've already decided that this is just what's good right now. It may come out that there are other processes that we can use to make it to where transitioning isn't necessary. But currently, weighing the pros versus the cons, transitioning is just what's best in some sense. Now, again, I want to repeat this because earlier I said most trans people don't actually get like sex reassignment surgery. I think it's around 30% of trans people, or yeah, 30% of people who transition get a sex reassignment surgery. Most of them just get put on like, yeah, like HRT or, something like that to transition like physically or like what the way that most people can view them out in public, but they're not getting sex reassignment surgery. And those who do, it's normally like because that it's serious enough for that to be the case.
It's when you say it's serious enough for that to be the case, I'm just like, okay, so they're mentally ill enough for that to be the case, right? Like that's the subtext. And so it's like I don't know when you talk about how extreme these surgeries are, it's like can people who are mentally ill enough to be able to get the treatment, can they consent to that? Because it's like I
Well,
don't
that's why
know,
you have a
man.
psychiatrist and a doctor to help them make those decisions. But like in the
I
end,
don't
yeah,
think
the person has to make the
it's
decision
so
themselves.
intimate that I don't think you can hand it off to a psychiatrist. It's like your literal crotch. Like
Well,
you
I mean,
can't
like, is Kanye
give a
West
psychiatrist
well
that.
enough to decide whether or not he should take lithium?
Wait, what?
Is
Well,
Kanye
yeah.
West well enough to decide whether or not he should take lithium?
I mean, lithium doesn't like literally burn your pussy off. Like if it did, like I would be like, no, you know? I
I
mean, lithium is like like an intense thing, but like when it comes to like the psychosexual functioning of a psychiatry patient, I don't believe in giving that up to a psychiatrist. It just scares me.
Yeah, I don't know. I mean, I know that this is not the only area where we tell people, hey, you have an issue here, so you should get some sort of body modification. These are common surgeries, like all sorts of things. We find medical issues that you have, and we try to fix them in the best way possible. And if we can find another better way, a best way where we have data that says, oh, this actually has better outcomes, then I would be in favor of that instead. But that just doesn't seem to be the case right now. This is something that, like, yeah, it's weird. It causes problems for trans people. It causes problems for society to like start to have to like rethink how it is that we use words like pronouns and gender and man and woman and all of these other things. Like those are all issues, and they like it causes bigger implications. But it is still in the end like the best we can come up with until we find something else.
Yeah, we'll see. We will see.
Well, just
I
I feel
have
like
to
you have to have that before you even say that you're against it. You have to have the better something else where
I
there's
think
data
that
that
the
shows that this
outcomes
is
are
better.
unhinged enough to where I do not. It's like lobotomy. Like it is like it's like it's crazy. Like these treatments are so crazy. The fact that phalloplasties and metoidoplasties aren't just like illegal as FGM is like insane. Like I know it's rare, but the fact that they're allowed to sell that to people on the basis of having been diagnosed with a mental illness is like so like how is it not literally criminal? I don't understand.
It is nothing like a lobotomy, Allie. Come on. It is
It's
nothing like
weird.
a lobotomy. You're taking away somebody's like ability to choose and ability to like be who they are with lobotomies. You're not doing that with transitioning.
You can take away their ability to function like at all. Like you can make them bedridden. You can take away their like you can take a perfectly able-bodied person and make them disabled. Which is you're right. It lobotomy is a different level because you do take away them. Like you take away them. You it's a literal eyeball piercing frontal lobe scramble. So it is different.
Yes, but wait, yeah,
But
but that's the point in a lobotomy versus like what you're talking about. You're saying, hey, there could be accidents that cause these negative side effects. That's totally different. That's not the point in getting the surgery. It's not
with
to
the
make
female
them bedridden.
ones though, with the fake penis surgeries, it's like it happens more often than not, it seems. I literally read an article where it was like the complication rate, it was something like 64%. It was like literally more often
Yikes.
than not, you're gonna have a serious fucking problem. Like
Wow. Yeah, I don't know. I like when it comes to this type of mental illness, I think somebody's issue with their body still doesn't take away their ability to choose or their ability to consent. So I still think that they can easily like make the decision for themselves as long as they understand the consequences and like understand like the chances of this, that, or the other happening. I know tons of people who have had sex reassignment surgery and all of them just like they were successful and there was no problem. So I don't know about these things that you're bringing up, but again, like a lot of the stuff that you're talking about, it just seems that there's not really data for this. There's just like small anecdotal like accidents that happen.
well, there really, at least in America, there like wouldn't be data, right? Because we don't have that centralized system, and it is a rare thing. So, and these hospitals where there are like little hot spots, right, where people from like all over the country who have money will like go to this city and like get this shit done. Like some of these hospitals will like, I guess, out of the kindness of their heart, like do research and keep tabs on people, but they are actually not required to at all, and a lot of them just don't. And so it's like, it just because there's not data, it doesn't seem like it's not happening, because you can read these reports where it's like, even like, I mean, the vaginoplasty complication rate for the people who aren't puberty blocked seems to be the lowest. It seems like that's like the most refined surgical technique, and it still seems like there's like serious things that can go wrong there. But seriously, with these like female ones, it actually like you're set up to fail. Like I don't understand like how they can do that to people, like knowing the average outcome, and it's just like any person who would sign up to get that done to themselves is like clearly not well. Like
Male to
because
female.
the female to male,
Oh, I
the
was gonna say I'm pretty
phalloplasty
sure
and
male
the
to female is like the
portoplasties.
most common one. Okay.
But okay, but like, how is the female one legal, or like the female to male? Sorry, they should not be. It should not be legal to sell that to like to
I don't.
mentally ill people. Frankly, to anybody, but especially to mentally ill people. Like they're a more vulnerable class.
You say mentally ill again, like they don't have the capability of
Well,
consenting,
they are
and
psych patients. That's like psych
it
patients have
doesn't.
rights
That's
to not
not
be
the same
experimented on
thing.
and
That's
to not be what?
That's not the same thing, though. They still have the capability of consenting. The mental illness does not necessarily mean that they can't consent. There are some mental illnesses that mean that you probably have less of an ability to consent, but this isn't one of those cases. You're using mental illness in a way that just doesn't actually
I think
align with what we're talking about.
well, no, but if you, I do think it's pretty insane to feel like you need to have this under your genitals to like be yourself. Not gonna lie, I think if you've gotten there, you're dealing with some shit upstairs. Peace and blessings, like much love, like we can be bestie friends. But like, yeah, no, you're pretty intensely mentally ill, I would say, and yeah, I would say that your ability to like maybe know what's in your own best interest is like impaired because you're about to, if you're a female, like you're about to do the arm skin sewn to the vulva where like literally the inside of your fucking arm becomes your new fake urethra. Like you are signing up for a urinary disability for like your whole fucking life. Like
Yeah.
you are signing up for that. Like no mentally well person does that.
All right. I mean, yeah, again, like if you want to send me the data on this that shows that that's the case, I have not seen this, but
Wait,
the
that's
it,
just a description of the phalloplasty. The radial forearm free flap phalloplasty. Like they flay the arm, they roll it up, they like that's stage one, and then stage two, they like put the implant in it, and then stage three, the fake testicles. But like
no, 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 no. When you're saying
stage
when you
one, like it's the urethra using the inside of the arm skin. What?
Yes, no, I understand all of that. I'm talking about like all of the negative side effects that you're talking about that come after that are such like happening at such high rates that we should just assume it's going to happen. Those are the things that I have not seen, that I don't know anything about. That if that's the case, I would have to look at it. But in the end, we would still just look at that and say, okay, this is one more negative side effect that we have to weigh versus the pros.
I'm looking for papers right now. I'm
But like your
unfortunately.
explanation is like, this makes me feel uncomfortable and I think this is weird, so I think they just don't have the
Well,
ability to
no, I
consent
think that it's
anymore.
like really fucking unethical. Like it seems like the complication rate is high, and even if the complication rate was something like 8%, like these complications are nightmarish enough to where it's like if 8% of people that got boob jobs had shit like this happen to them, I don't think we would be selling boob jobs. Like I actually don't think, like I think the only reason they get away with doing this is because it's such a small group of people. But I
Well, I
actually
don't
think that
like lip
what
injections have really high complication rates, yet we still allow people to get lip injections. Those are like,
but the complication of a lip injection versus the complication of one of these surgeries, like you're talking about like perhaps like filter migrating and then like an inflammatory response from that, which those can be pretty rough and they're on your face, so it's like a cosmetic issue, but it's not going to make you bedridden except for
well,
in
no,
extreme
you said
cases.
boob job, so I'm comparing
Oh
cosmetic
yeah,
issue to cosmetic issue.
yeah, but I mean, what I'm saying is if any like plastic surgery, any like taking of healthy tissue and changing it for reasons of appearance, like if any of that had a complication rate like this, I think it would be like that is done to a bigger group of people. I think it would be banned. I think the reason that the phalloplasty and the metoidoplasty have the rates that they do, and they're not just illegal, and people are allowed to sell this at all, is because it happens to so few people that you can basically just sign NDAs with like the people who are the most worse off and the like most likely to be able to sue you for a lot of money, and then you can just keep going if you're one of these surgeons performing these like batshit operations.
Okay. Well, yeah, if you want to send me the stuff about the complications, I'll try to look at those sometime.
Okay, I will like get to googling after this, but I have read before. Like I've read multiple things that say it's above 50%, like where it's more likely than not. Like I've read and it's specifically urethra. So it's like specifically like that is an enormous thing if you're rendered incontinent as a very young person. Like that is just like bad. Like
Yeah.
okay, but thank you for talking to me.
Yeah, thanks for coming on. It was nice to
Bye.
see you again.
Oh, sorry.
Later, dude.
Yes. Bye.
All right. Um, yeah, I feel like there's like this bias there ahead of time that just makes her view everything in a negative light when I don't know what the negative is a lot of times, and then when we actually get to some sort of like objective negative there, it's just it's something that I know nothing about, that I haven't seen that data, and I would have to actually look at it to evaluate it in that way. So